Let's begin with NBC News Now correspondent Dasha Burns. She's inside one of New Jersey's mega vaccination sites. Dasha, good morning. Now, I know this vaccine site was closed for several days this week due to, of course, what we're hearing about everywhere, supply shortages. There were not shots to put into people's arms. So what's happening now?
Hey, Savannah. Yeah, that's right. They reopened back up on Wednesday, and they're just opening for the day this morning. You can see the vaccination stations just getting up and running right now. And talk about mega site. This place is huge. It used to be the Meadowlands racetrack. You can see some remnants of the racetrack here, but they have turned it into this massive vaccination site. They have 20 vaccination stations here. They can vaccinate. They have the capacity to vaccinate 2,400 people a day. And I'm just going to walk you here just to show you how big this place is. They've got 40 National Guard here, at least 50 other employees. So around 100 people working here, and they could scale this thing up, Savannah, at any moment. They really essentially have endless capacity from what I'm hearing. But today, they've got about 600 doses that they can give out, 600 versus 2,400 that they could do each and every day. So they're really using only a fraction of this massive infrastructure that's been built out here. And that's something that we're really seeing across the board, Savannah.
And New Jersey invested a lot into vaccine storage to make sure this rollout went smoothly. Dasha, you in places across the country showed us what that storage looked like. It was very cool to see some of these freezers and such, but a lot of that space in New Jersey is going to waste. Tell us more about that.
Yeah, I mean, it's so interesting, Savannah, because a couple of months ago when we were first starting to talk about vaccine rollout and how states, counties, municipalities were preparing, the big questions we were asking was, can they really do this? Can they build out the infrastructure? Can they get their hands on those freezers? Can they get the refrigerated trucks necessary to distribute? All those questions, right? And what I've learned that at every level, from small municipality to county to state level, that's been done. The infrastructure has been built. The legwork has been put in. The problem is there's no supply. So we were in Bergen County yesterday where they invested in freezers. They bought enough to store about 1 million doses, Savannah. But right now, those freezers are completely empty. They were expecting to have the vaccine to put in them and then to put into people's arms. But the reality is that's just not happening. I want you to hear from the Bergen County executive, Jim TEDESCO. Listen.
So this freezer is about 500,000, maybe more, of Moderna that can be stored in here. Unfortunately, it is empty.
500,000 here, probably 500,000 in these.
So
you could probably store 1 million doses in here.
Yep, and be able to get it out into the community if we had to. It's disappointing. But at the end of the day, we know that it's about how this really started, and that in the beginning, everybody talked about how much mass doses of vaccine were going to be put out there, and the reality is set in that that's not true.
I mean, Savannah, the list of logistics that each of these vaccination sites have had to go through. I mean, talk about filling up an entire racetrack facility with medical equipment, with tables, with personnel, with even just the privacy curtains that you see hanging here, creating a hospital setting at a racetrack, right? The things that nobody thinks about and the legwork that's been put in. The good news is, this is here, right? So as soon as that supply is available, as soon as they are able to scale up, they are ready and very, very eager to do so, Savannah.
Dasha, it is wild to think back to how much we were talking about things like, how's there going to be enough dry ice for these? And what we don't have is the shots. We have everything else. So what do we know about when New Jersey is going to get more of them? When do health officials expect to fill up these freezers?
Yeah, so I spoke to the governor, and he is optimistic, but he's asking for patience because it's going to take time to really scale the supply up. He says from the conversations that the state is having with the Biden administration, they're working as quickly as possible, but it is going to take a little bit of time. So they're getting these shipments every single week. Right now, it's just not enough. It's increasing bit by bit, but they're hoping in the next couple of months to really have this place operating at full capacity, Savannah.
Dasha, thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.